Every 60 seconds, 5 South Asians die of heart disease, and nearly half of these heart attacks occur before the age of 50. This is Dr. Nawaz, heart doctor from Dallas, talking about why South Asians have such elevated risk. We tend to store more fat around abdominal organs, which is called higher visceral fat. Visceral fat leads to increased inflammation, insulin resistance, and ultimately atherosclerosis. We also get insulin resistance earlier and form diabetes earlier. South Asians also tend to have a more atherogenic lipid profile, lower HDL, higher triglycerides, higher prevalence of lipoprotein a, high ApoB. Our genetic predisposition causes us to have these, leads to South Asians forming heart disease 5 to 10 years earlier than other populations. In 2026 guidelines, South Asian ancestry is recognized as a cardiovascular risk enhancer. About how to diagnose it early, clinical exam, blood tests, and imaging tests. Cholesterol panel is routine test, but in addition to that, I also check ApoB, the test that measures the actual particles that can enter into the blood vessel wall and cause a heart blockage. I also check lipoprotein A levels. This is an inherited cholesterol particle that can dramatically increase your cardiovascular risk. Also check HSCRP, which is a measure of inflammation linked to increased cardiovascular risk. HbA1c, urine ACR, fasting insulin. In imaging, use coronary artery calcium as one of the most useful tests for screening. I recommend for anybody above the age of 40, and I interpret the scores very carefully because anything other than 0 is technically abnormal and should be analyzed and treated in the context of patient's age and comorbidities. So on clinical exam, I usually look at blood pressure. Should be lower than 130 by 80. Next thing I look at is waist circumference. It should be less than 31.5 inches for women and less than 35 inches for men. Being South Asian increases your risk, but it doesn't have to determine your future. We're talking about how to reduce that risk. Number 1, lose belly fat. South Asians have higher visceral fat, so we need to reduce belly fat to decrease that visceral fat. Let's focus on a more healthy South Asian diet. More vegetables, lentils, legumes, nuts, whole grain, healthy fats, and let's take out sugar, refined flour, ultra-processed foods, and fried foods. You have to incorporate exercise into your life. How much exercise gives you most of your cardiovascular benefit? 150 minutes a week, which translates into 30 minutes of aerobic activity 5 days a week, plus 2 to 3 days of strength training. Very important, control your numbers. Blood pressure, less than 130 by 80. HbA1c, less than 5.7. Waist circumference, less than 35 inches for men and less than 31.5 inches for women. Now let's talk about if the ApoB is abnormal or lipoprotein A is abnormal or your calcium score is high. Please follow along and we'll have a series of how to treat early cardiovascular disease with medications.